vaccine. It's really important to get vaccinated so you're immune before you're pregnant or before you do a treatment, because the risk when you're under, say, an egg donor that's under stimulation is has certain risks to them. So having the vaccine before being immune is very helpful. Or even during a stimulation, I'd be very happy for them to get vaccinated. And the same with surrogates. If you can get vaccinated before you're pregnant, and I'm actually starting to write letters now for all people that are in treatment or pregnant to get their vaccine as soon as possible, because I think we would definitely consider them to be a higher risk population.
Okay, and the same question for men who are going to be depositing their sperm at the clinic. Is there any delay that they need to vaccine to when they can leave their sperm, or can they just go ahead as normal?
That's also a good question. And my opinion is, based on everything I've read, that you should go ahead as normal. It doesn't affect your sperm. It doesn't affect anything to do with the ability for your sperm to do the job in terms of creating an embryo or pregnancy.
Okay, and then next question that, we keep hearing about this, AstraZeneca and blood clots, and I keep seeing floating around the internet saying that pregnant women should be taking a blood thinner if they're going to have the vaccine. Is that a wives' tale? Is there any evidence around that?
So I think it applies to both the J&J and the AstraZeneca, because that's where these reports have come out. But they're like 1 in a million types of things. If you have a history maybe of blood clots in you or serious ones in your family, then you may consider getting the Moderna or the Pfizer in that situation. But even if you do, and that's the only vaccine you have accessible, the J&J or the AstraZeneca, I would say that the risk is so low that you just be monitored afterwards. And I don't think that anybody should withhold having the vaccine because of that reason. And J&J has come back on the market now after all the extensive testing that they've done.
Excellent. That's so important. Now, in terms of surrogates or people who have gone through IVF that are our clients, they're asking, my surrogate's in the second or third trimester or about to deliver. Are you suggesting that they get the vaccine as well?
Absolutely. There's no evidence the vaccine affects the baby during the pregnancy. In fact, maybe the opposite. It actually helps the baby, because there are antibodies that are transmitted through the placenta to the baby that may protect the baby against getting COVID as well. And also, pregnancy, unfortunately, is a high-risk situation in general, and there are risks of things like diabetes and high blood pressure and so on. And so if you can get that vaccine as soon as possible, I recommend it. Unfortunately, there are women, I shouldn't say have been, there are women now that are sitting in ICUs that are very sick with COVID, that are pregnant, especially in their third trimester, and it's becoming a big problem. So the sooner that you can get it, and your doctor should write you a letter to say that you should be prioritized as a pregnant woman. And I think I wrote 3 letters today to that effect, and I really promote everybody get the vaccine. And also, if you have your partner and they may be exposed to a high-risk situation, have them vaccinated too. So it's really important to get everyone in your life also vaccinated if possible.
Excellent. Now, the other question, a little bit more, loaded. Would you suggest that if people haven't begun treatment, that they wait? Or is now as safe a time as ever to go ahead and move forward with an IVF cycle?
So I don't suggest they wait. The reason is because in terms of pregnancy, the major risk is really during the third trimester. That's been shown, and that's when we're seeing issues. So if you can get the vaccine even in your first trimester or early second or even late second, I think it's better to just get it at that time. And you shouldn't delay treatment, because vaccines are becoming more and more available over the next few months. And I think eventually we're all going to have access to it, regardless of our age or other underlying situations. So I think that if you're getting pregnant now, you should go ahead and not stop the process.
Okay. And in terms of transmission in clinics, has there been any cases of transmission through? There's been, talk about, fertility clinics being essential service, which obviously we fully support. But, how safe is your clinic right now?
Well, that's a great question. And all the fertility directors in Ontario, because of a new directive that came out regarding essential services and so on, got together and we all talked about this issue, a very important one. And we came up with a statement. It's on our website, and it'll probably be on almost every fertility clinic's website in Ontario anyway, that says that we're an essential service. We're going to stay open. There have not been cases of transmission or outbreaks within fertility clinics. Sure, there have been people who've been exposed to a partner, but none of them have resulted in outbreaks within a clinic setting in terms of fertility clinics. So I think they're one of the safest places you can go. Certainly going to a store or other types of facilities where they don't have the kind of protection that we have, where everybody is doing all the social distancing and masking and screening at the door and so on. And I think fertility clinics are safe to go to at this point.
Excellent. Jordan, I don't know if we have any questions from our live, but I have one question that just came into me by text.
I just wanted to add one thing I forgot, is that every single person in our clinic has been vaccinated at least once. Many of us, like myself, twice already in full vaccination. So I think that's also an important thing, that you're going to a place where people have been vaccinated as well.
Excellent. And then the question that was just sent is, if an egg donor or sperm provider is COVID positive but asymptomatic, is COVID something that can be transmitted through IVF to the surrogate or to the baby?
No, there's no evidence it is, but the vaccine will create antibodies that will protect the baby during pregnancy, but there's no evidence that it will be transmitted through while you're pregnant to the baby. But at the time of birth, if you had COVID, that potentially could be a time where you could transmit it at that time.
So if our clients or people are going to be moving forward with an IVF cycle at your clinic are interested in getting this letter that will hopefully prioritize the vaccine line, who would they reach out to? Would that be their nurse that they would connect with to
Absolutely. And we're going to have put together sort of a form letter. We're doing it individually right now, but I think that everybody should have access in any fertility clinic to a letter that says that they should be high priority for vaccination.
Amazing. Thank you. Jordan, were there any other questions that came in?
A lot of people just joining us live now, but we did get a question through Instagram. Does it matter which stage of pregnancy you're at to be able to get a vaccine?
Well, in terms of getting the vaccine, I'm not sure that they're distinguishing different trimesters, but I think the sooner that you can get it, the better. And all of the data so far, and we don't have complete data, but we have now thousands and thousands of pregnant women that have been vaccinated around the world, which with almost all of the vaccines, and it's been shown that they're safe. They don't have live virus. They're all mRNA or other types of virus of vaccination methods, and they're all safe, we think, in pregnancy based on all the data we have so far. And I think that all the data will show that. And because there are other vaccines that are similar types of vaccine that are all been shown to be safe in pregnancy, I think we can very well extrapolate to this vaccine.
Well, one more question. They were just wondering if they've already graduated from a clinic, can they still get a letter for a vaccine?
Absolutely, we'd be happy to do that. We still consider you our patient until you give birth and have the baby, even after that. So whenever if you need a letter from us, I mean, I'm sure your family doctor or obstetrician, gynecologist or midwife would also be happy to write it. But if you're not able to get it, we would be happy to do that.
I have one last question. Is there a reliable source of information that you would suggest people look at, as this person is becoming very overwhelmed by all of the Facebook and Instagram stories and posts on COVID?
So there are statements by the American Society of Reproductive Medicine. There's also the American College of Obstetrics and Gynecology. And
Okay.
in Canada, there's the Canadian Fertility and Andrology Society, as well as the Society of Obstetrics and Gynecology of Canada, SOGC, which is the Obstetrics and Gynecology, and the CFAS, Canadian Fertility and Andrology Society in Canada, ASRM in the States, as well as ACOG or ACOG.
Perfect. So Jordan will, Jordan, if we can post that link in our Facebook page, and we'll share that on Instagram as well. That was the last question I have. Jordan, was that your last question as well?
Yeah, that's everything.
Thank you so much, Dr. Librach. I know you're busy and I've been chasing you all day. We've had so many questions, and I really want to provide as much, and I know you're, definitely my go-to information. So thank you so much.
And I thank you, because this is so important. We need to protect all these women, these amazing women that are surrogates or people getting pregnant on their own from this virus. And the more we get out there that you should get the vaccine, the better. We had some of our nurses at the beginning were scared of it, and they didn't know when they were pregnant. And all the information started coming out. We bombarded them with the information saying, it's safe, you should do this. And they all did it eventually.
Excellent news. And, for many of our donors and surrogates, they will be so reassured by this information. And again, Dr. Librach with Create Fertility Center in Toronto, and is a dear friend and, our favorite place for people to get pregnant. So please, if you don't know the clinic, please look them up. And like you said, there's a statement on their page regarding COVID-19. Really important. Do your research. Make decisions that are best for your family and for the people that helping to become families. And thank you so much. And thanks, Dr. Librach, again.
My pleasure. Anytime.